Hello, and welcome to the Georgia Academy of Family Physicians and Oklahoma Academy of Family Physicians Go Diabetes Project webinar. This is our first webinar, and we'll be discussing METRIC and giving a local program. What I'd like to do first is just go through the process of using these webinars, and if you notice that at the very top, you'll see a drop-down tab which will give you some information on how to ask questions. And we want you to make sure that this is interactive, although initially you're on mute. We want to make sure that you know how to ask questions, and you can do that either through chat or at the end of the presentation we'll make the microphones live. My name is Susan Reichman. I'm the Go Diabetes Project Director and the Purple Team Coordinator. And today, as I said, we're going to be talking about using METRIC and presenting a local program. I want you to think of METRIC as improving patient outcomes and enhancing your practice by using an assess, implement a change, and reassess process. You can also think of METRIC as earning CME credit, and it does meet the Part 4 requirement for maintenance of certification. This video is a short clip from the AAFP. And so that tells you a little bit more about Metric. As you may have heard in the Train the Trainer session, the Go Diabetes Grant will pay the actual registration fee for all participants to register for Metric. That includes AAFP members, family medicine residents, and the residency program faculty of any and all specialties, and then all other clinical staff, and even administrative staff if the program or practice wants to have more people participate to get a larger patient sample size. The process, as you've heard, is to pull a minimum of 10 charts of diabetic patients and a maximum of 50. And these patients need to be seen, have been seen before your local training or your Train the Trainer session. Use the worksheet to pull the data elements from the chart so that it's easy to have those 10 to 50 sheets right next to you at the computer when you start to do your Metric data entry. If you have an EMR and a laptop, some people have gone ahead and booted up both systems and just transferred the data electronically that way. This is the actual form that we have available to you both on the website and via email. That just is a simple way to export the data from a chart onto this piece of paper, which then is in the right order as Metric asks you the questions. And it will take probably 7 minutes per chart once you've done the first one. Remember, this is a practice improvement project and not a measure of how one individual provider is doing. Many residency programs and practices go ahead and print out a list of every diabetic patient and divide the names so that other members of the team can enter data. This is particularly helpful with residency programs where you have interns who may not have seen 10 diabetic patients, and they can borrow patients from other providers. This gives a clinic the largest sample size possible and goes ahead and makes the time needed to do data entry as reasonable as possible with each participant. Before you register for Metric, you'll need a valid AAFP username and password. This is if you're an AAFP member, you already have this information, but if you're not, then you can get a non-member AAFP number for this project. You just need to call the contact center at this toll-free number. And the AAFP is located in Kansas City, so they're on Central Time. Once you get your login and your password, then you need to go to the aafp.org Metric Diabetes website and follow the instructions that we've emailed to you on the instruction sheet. They're also posted on the website. These are step-by-step instructions, and because it's a computer, if you skip a step, it won't work. So need to follow those in exact order. Remember to use the code in the discount field so that your balance due goes to 0, and that code is written on the instruction sheets. Make sure you have your group ID, which is provided by your team coordinator, since using this group code will make sure that your data is incorporated into the Go Diabetes data set. And it also then enables each practice and or residency program to view the aggregate data for their specific group. Initially, after you've registered and logged in, you'll be asked to answer 16 practice assessment questions. This is not really a test, but it's a process to begin to help you thinking about systems of care that you currently use, those that are working well and those which could be improved. Again, with practice improvement, we're looking at not so much individual patient outcomes, but we're looking at how the practice provides care. The questions will ask things about how decision support is in your practice, what the community linkages are, what's the design of the delivery. And each of these, though it sounds like a lot of questions, each of these is a simple read the question, hit the radio button, and move on. So this really does not take a long time to do. Then you get to the data entry, and you enter the 17 data elements for each of your patients that you're including in this project. Once the data is entered, the system will show you a report, and it shows how your data compares with others in your group for baseline. Now, if you're the first person from your clinic or your residency program to enter data, then the number is just going to be your information. But as people add to that, you will begin to then see changing numbers. Another column will show you your data, your results, compared to anyone else who has worked in the Go Diabetes project for this year. And the third column is anyone who has done a Metric diabetes module ever. We encourage you then to really look at this report with your colleagues for opportunities to improve care. Look at the results, use your PI tools that you learned in the Train the Trainer session, and identify a few areas to focus on, and then to identify changes that might improve those results. And so this is where you're going to look at process mapping, you're going to be looking at your aim statement, and use plan, do, study, act cycles to improve processes. Once you get the data and you review that, the next step in Metric, it will give you some opportunities or some ideas for making changes. And this is a list of those suggestions. Now, this is a list of suggestions only. If you all find that based on your data that you want to look at other areas, absolutely that's what you can choose to work on. And most practices pick 2 to 3 areas to work on based on the data. Again, it doesn't matter who enters the data. The key to a successful project is the entire team looking at the results and being actively engaged in the process to improve care. So if the practice or the residency program chooses to get the list of patients, extrapolate the data, and have 2 or 3 people enter the data under different IDs, that is just fine. Again, as a summary, you need to gather data from a minimum of 10 and a maximum of 50 diabetic patient charts of patients seen before your training session. Enter the data and look for opportunities for change. Implement changes using the PI tools. Now, this is what the next is one thing that's a little different. Metric is set up to automatically send you an email 30 days after you enter your baseline data. Our preference and our request for this project is that you actually wait 90 days before pulling another set of charts and doing your follow-up. So we will be sending emails out to remind people to ignore the email that comes automatically after 30 days and to wait 90 days before doing your follow-up data entry. We feel that the 90 days is perhaps a better reflection of the opportunities to implement change. Do your follow-up data. Again, look at the results, and they will be reported in the same 3 columns. And use your results to consider developing a research poster or a publication. Regarding maintenance of certification, if you complete all steps of Metric, that will generate 20 CME credits from the AAFP. The AAFP automatically will report the completion of Metric as a Part 4 requirement for your maintenance of certification to the American Board of Family Medicine. While our grant is paying for your Metric registration, you still need to pay the American Board of Family Medicine for all of the activities around your maintenance of certification, including using Metric to meet the Part 4 requirements. Those payments, again, are to the ABFM. Now, giving a local program. Within 6 to 8 weeks of attending your Train the Trainer session, you need to share the Go Diabetes project with your colleagues. What does a local program look like? I know many of you have heard me say this before. It needs to make sense for your clinical setting. Many practices or residency programs have done a 1-hour session grand rounds. Others have done several short sessions and staff meetings. Others have done a series of lectures of varying times covering the project and the topics. If you all have just had a clinical update on injectable meds, then that may not be the area that you need to focus on. It may be that you look at oral meds, or you look at preventive measures, or you look at what makes sense for your clinical and clinical team to hear. It might be that you talk about metric results. It might be that you're teaching about using practice improvement tools, and that you have a session on looking at process mapping. And if you have another session then on writing an aim statement. Do take the time and take the area that makes sense, as I said, for your practice. Now, all the presentations that you heard at the Train the Trainer session are available on our website, which is www.godiabetes.org. And you can download those under the resources column. This webinar is being recorded, and you can use the metric instruction slides or visit the website at AAFP for additional instructions on using metric. We want you to then go ahead and talk about metric, though, in your local program, because we are asking you as change agents to recruit as many colleagues as possible to register and participate in metric. We want everyone who attends your local program to sign in and to give us their email. We use those emails to notify people about the webinars, and we will also add their names to the mailing list so that they get the News on the Go, which is our frequent electronic newsletter that has updates and information about our project. This is the actual form that we have emailed to you, change agents, to use for your sign-in sheets. Make as many copies as you want so that we can have this information when it's and have it be legible when it's faxed back to us. Once we receive that sign-in sheet, that will generate a check request to pay the honoraria to the presenters who are listed. Again, this honoraria is $3,000 per practice or residency program. Now, this honorarium can be paid to a practice or a residency program if the change agents don't want to report the honoraria as income, or if the individuals presenting are state employees, or there are restrictions on them receiving an honoraria for a project involved at their clinical setting. All you need to do is just make a note on the sign-in sheet as to who the check should be made to. Again, if you're listening to this as a recording, please email me at susan@godiabetes.org with any questions that you have, or give us a call, any of your coordinators. Thank you for attending this webinar, and we hope to hear from you soon.